A warm good evening to one and all. And in this session, we are going to discuss about the endocrinology of pregnancy and parturition. So, what is this pregnancy and parturition deal with? So, it is a very special moment in a female, the pregnancy or the gravidity or the gestation, which means that the female is going to give birth to the young one, or she is going to deliver more offspring, which is going to develop inside a woman, that we normally call as pregnancy. During pregnancy, hormones play a significant role in triggering changes in the mother and the fetus. So, this special moment is carried or is continued with a rhythmic secretion of the hormones. Hormones maintain the lining of the uterus and prevent the menstruation. When once the uterus is embedded with the embryo, implantation, when the uterus is getting implanted with the fetus or the embryo, from that moment onwards the hormones is taking the role and taking the control to prevent the menstruation. And hormone increases the flexibility of the pubic symphysis, which is going to help in the parturition. And the hormones is going to determine the time of the birth. And there are certain hormones which controls the pregnancy. So let us see what are all those hormones which is going to control the pregnancy status. The first one is the estrogen hormone, and the second one is progesterone, and the third one is relaxin hormone, and the last one is human chorionic gonadotropin hormone. So these are the four hormones which is going to control the pregnancy. So what it is going to do? Choriotropic hormone. So what is the role of the hormones in the pregnancy? Yes, estrogens play a vital role. Excuse me. So this estrogen is going to play a vital role in the pregnancy. The estrogenic group of hormones comprises three hormones. So this estrogen has three main hormones, what we call as estradiol, estrone, and estriol. The estradiol is the most active hormone present in almost all the vertebrates. Almost in all the vertebrates, estradiol is present. And estrone is the circulating hormone which is going to get circulated in the bloodstream. And the estriol is found in the urine of the pregnant women and in the placenta. So only during the pregnancy, the estriol hormone is going to be found. And that is found in urine as well as in the placenta. So the secretion of estrogen, one is by the ovaries and another one is by the placenta. When the woman is pregnant, during that time, the placenta starts to secrete the estrogen. So like corpus luteum, placenta secretes estrogen and progesterone. So the corpus luteum found in the follicles or in the ovary, that secretes the estrogen, we know. Okay. So apart from that, the placenta is also secreting the estrogen and progesterone. And this is secreted by the syncytial trophoblast cells of the placenta. So in the placenta, which is secreting this estrogen and progesterone. So it is the cell, what we call as syncytial trophoblast cells. Towards the end of the pregnancy, the daily production of estrogen is getting increased. It will be increased to threefold or fourfold. And secretion of estrogen by placenta is quite different from that of ovaries. It is not like the routine one. Ovaries will be regularly synthesizing the estrogen. Placenta secretes the androgenic steroid compounds. What is that? dehydroepiandrosterone and 16-hydroxy hydroepiandrosterone. These are the two things which is secreted by the placenta. And these weak androgens are converted into estriol, estradiol, and estrogen. This estrogen plays an important role on most reproductive and associated organs of the mother. So, what is this reproductive? That is in the cervical region and associated organs. What is that associated organs? Breast, pelvic region. All these are the associative organs of the mother. Extreme quantities of estrogen cause certain things to happen in the mother. When more amount of estrogen is produced, it causes certain changes in the mother. So what are all those? Enlargement of mother's uterus, which is very, very important for the fetal development. When the fetus is getting developed, the uterus should accompany the size. For that, the enlargement of mother's uterus is very, very important. And next one, enlargement of the mother's breast. Yeah, obviously, it has to be. Then only the mother can nurture the young one or the offspring. Enlargement of female external genitalia. All these are very, very important thing. Why so much amount of estrogen is produced? Because until then, the external genitalia is enlarged. The fetus cannot come out. The parturition cannot happen. So that is also very, very important. And relaxes the pelvic ligaments of the mother. Of course, the relaxation of the pelvic ligament, pubic symphysis, is the foremost one. Then only the crowning of the head can happen. The secretion of progesterone by placenta. So the placenta secretes two hormones we said. One is estrogen and another one is progesterone. Already we discussed about the estrogen. And now it is about the placenta. It is equally important as estrogen. Secreted in moderate quantities by corpus luteum at the beginning and secreted in tremendous quantity by placenta in the later stages. So in the initial stages, the corpus luteum will be taking the role in hand, and later on, once the placenta or the umbilical cord develops, the placenta is taking the role in hand, and it increases tenfold during the course of pregnancy. See, the secretion of progesterone is getting tenfold more. It increases, which causes the decidual cells to develop. Like when the estrogen secretion happens tenfold or more, it has four main reasons: enlargement of X and Y, and we spoke about that. And now, this progesterone secretion causes the decidual cells to develop in the endometrium, which is very, very important for cushioning the fetus. Decreases the contractility of pregnant uterus. So it should not contract. When it contracts, the baby can or the fetus can come out. So it should not happen. So it decreases, the progesterone decreases the contractility of the pregnant uterus. It helps to develop the conceptions, holds to holds the development of the fetus. Along with the prolactin, estrogen helps to prepare the mother's breast for lactation. Progesterone, prolactin, along with that. The estrogen also helps in the preparation of lactation. And what is this HCG? Yes, human chorionic gonadotropin, secreted by the placenta and which is found in the urine of the pregnant women, which nourishes the egg after it has been fertilized and become helps to attach the uterine wall. The fertilized egg is getting attached to the uterine wall. That is done with the help of this HCG, human chorionic gonadotropin. And this is a protein hormone which weighs about, the molecular weight weighs about 38,000 kilodaltons. And the levels, how much amount of HCG is found. So the level can be first be detected by the blood test about 11 days after the conception. and about 12 to 14 days after conception by a urine test. As I already said, the HCG will be released through the pregnant woman's urine. So, with the help of the urine HCG, even we can confirm the pregnancy. It is the important test for confirming the pregnancy. In general, the HCG level will be doubled every 72 hours. The level will reach its peak in the first 8 to 11 weeks of pregnancy and then will decline. It will be off for the remainder of the pregnancy. So, initially, from the 8 to 11 weeks of the pregnancy, you can take a note of this HCG will be in the peak, and it enhances the maternal breast growth by increasing the protein synthesis, and it also increases the fatty acid for ATP production because the mother needs more energy since the developing fetus in the womb requires more energy. The mother needs to supply more amount of ATP, leaving more glucose available for the fetus. And the HCG also helps to maintain the pregnancy and affects the development of the fetus. That also is done. And the hormone oxytocin is going to play a key role in the labor. Labor is nothing but the parturition or the delivery pain, often called the love hormone. Oxytocin is associated with the feeling of bonding and motherhood. When the mother carries the young one, it can feel the mother is holding. When some other stranger or anybody else in the family starts holding the baby, it starts to cry because it can smell the oxytocin secretion from the mother. Hence, it is called as the bonding and motherhood or the love hormone. And this is also true for another hormone released during the labor called prolactin. If labor needs to be induced, that is, if the delivery needs to be induced, that is due to some medical complications, if it has to be brought on artificially, oxytocin or a synthetic oxytocin equivalent is often administered to kickstart the labor pain process. Oxytocin level rise at the onset of the labor, causing regular contraction of the womb and the abdominal muscles. Womb is nothing but the uterus. Oxytocin induced contractions become stronger and more frequent without the influence of progesterone and estrogen, which at high levels prevent the labor. So, this picture clearly will make you to understand what is the process. So, see, the fetus is found inside the womb. When the head of the fetus comes and hits the cervical region, this is the cervical region, cervix. When the head pushes against the cervix, what happens is it creates a nerval impulse to the brain, and the brain stimulates the pituitary to secrete the oxytocin. Oxytocin will be carried in the bloodstream to the uterus, which makes the uterus to contract and relax, through which the baby can come out, the fetus can come out. So, this picture shows you the clear picturization. And this is another picture or illustration which makes you to understand the process in a very clear way. So, this is the first step, fetal stress. The fetus will be having a stress to come out. That stress stimulates ACTH, corticotropin hormones, which stimulates the cortisol to be released from the adrenal glands. And this adrenal gland releases the cortisol. See, releases the cortisol. When the cortisol is released, what are all the effects? What the cortisol is going to do? So, this is going to decrease the progesterone secretion, decrease the estrogen secretion, and increase the prostaglandins. Why the prostaglandin is getting increased? This prostaglandin is going to increase the uterine contraction, which helps to move the fetus head. Crowning of the head is going to happen. That is the reason. And then, fourth step again, the uterus will be getting stretched. increased stretch will be given to the uterine walls, which stimulates the sensory nerve fibers around the area. Nearby area will be sensitized. This sensory fiber stimulates the oxytocin production from the hypothalamus. See, it goes and stimulates the hypothalamus. So what happens? Hypothalamus, where the oxytocin is stored, that will be secreted. The posterior pituitary makes the hypothalamus to secrete the oxytocin stored in the hypothalamus. And once oxytocin is released, causes the uterine contraction, stimulates uterus to make more prostaglandin. More pressure will be given to secrete the prostaglandin, which causes the pressure, and the baby will be coming out. Parturition happens. Mechanism of hormones in pregnancy. So this is very clearly explained. The menstrual cycle stops typically during the pregnancy, and the corpus luteum is the structure. When the ovulation happens, an egg or the ovum emerges out, leaving behind a small structure called as corpus luteum. And this structure, this corpus luteum, is going to produce the progesterone and estrogen, which is going to help or assist in the preparation of the uterus for the implantation of this fertilized egg. If the egg is not fertilized, what happens? The corpus luteum regenerates, causing progesterone and estrogen levels to drop and the menstruation to begin. If the ovum is fertilized, on the other hand, the corpus luteum remains intact and starts to produce more amount of progesterone and estrogen to keep the uterus baby friendly. Eventually, the placenta develops the ability to secrete necessary hormones. So the corpus luteum disappears 3 to 4 months. So this is the picture which shows the narration here. In addition to the progesterone and estrogen, human chorionic gonadotropin, already we said, which spikes in the early pregnancy, that is in the first trimester. We have 3 trimester. First 3 months, second 3 months, and third 3 months. So 3 trimesters we have. In the first trimester, the human chorionic gonadotropin is going to be in the peak level. That will be more in the amount. The levels of this hormone doubles every 2 days. That is in first 10 weeks of the pregnancy. Its primary role is to prevent any further menstruation to happen or for the abortion of the baby. The rapid increase in the levels of the human chorionic gonadotropin makes the increase in the second trimester for the estrogen and progesterone. Here the estrogen and progesterone level is getting increased. You can see estrogen level and progesterone level is very low in the first trimester, whereas HCG, human chorionic gonadotropin, beta human chorionic gonadotropin, is more in the first trimester and it downs, it reduces. Whereas in the second trimester, that is in the 6th month, estrogen and progesterone is getting more. See, in the 9th month, it is getting increased. You can see. And in the 3rd trimester, that is in the 9th month, almost all the hormones will be getting drop. Drop in all the hormones. No estrogen, no progesterone, nothing is there. Everything drops down, which is going to indicate the parturition is going to happen. So this image also illustrates about the secretion or the feedback mechanism, how the hormones are secreted, how it is going to happen. You can see here clearly. The hypothalamus. See what happens? Mechanoreceptors. The milk ejection or the breast is getting developed. Uterine contraction and onset of the labor. Some pain will be there. This heating of cervix causes or called as mechanoreceptors, and this makes the oxytocin to be released. When the oxytocin is released, milk ejection takes place. We already discussed in the lactation, that is before to the parturition and after to the parturition, 2 days prior onset of the parturition and after the parturition 2 days, a fluid will be secreted that we normally call as colostrum. Colostrum. So that is secreted because of this oxytocin. When oxytocin is secreted, the oxytocin makes the mammary glands to eject the milk due to the reflex. And here it contracts the uterus for the onset of the labor. So this clearly is shown by the picture.
So thank you all. And here I would like to convey my thank, or I would like to acknowledge the unknown people who work for the GIF and the regular images, and also for the source of the content. And the video is only for the educational purpose. Thank you so much for your patient listening. And in the description box, I have given an MCQ. So just attend the quiz to enrich your knowledge, or to identify how much you have gained. Thank you once again. We'll meet in the next video in the same series of endocrinology. Thank you all.